स्वास्थ्य सेवाओं की प्रगति, चुनौती और नए आयाम के लिए बिग हीलिंग हैंड्स 2.0 कॉन्क्लेव एंड अवार्ड्स का भव्य आयोजन चल रहा है। आपको सीधे लिए चलते हैं।
That are dissatisfied because knee replacement, hip replacement is a quality of life surgery mostly. लोग करवाते हैं कि वो बेटर चलें, ज़्यादा चलें, enjoy करें life. So there is a good chunk of patients, almost 10 to 15% in all practices that are dissatisfied. जो बोलते हैं कि आपने क्या लगा दिया घुटने में, unnatural लगता है घुटना मुझे, मेरा घुटना नहीं लगता. To reduce that number, I think precision is very important. A robot gives us the ability to plan surgeries in pre-op. Execute that to a millimeter or to a degree of precision, जो humanly is 95% or maybe 96%, but with a robot it is almost 99%. Precision helps you in improving recoveries because आपके अचानक से pain कम हो जाती है, people are more mobile, first 6 weeks especially. जो एक बहुत बड़ा कंसर्न था पहले कि घुटने की सर्जरी कराने के बाद मुझे दर्द बहुत होता है. विद रोबोटिक्स वी आर एबल टू एक्चुअली प्रैक्टिस ERAS protocols, enhanced recovery after surgery protocols, where we are able to send patients home on day 2, day 3, things like that. And all of this will lead to more centers performing robotics, which is very good because that will mean democratization of good knee replacement to people. ऐसा नहीं होगा कि मैंने वहाँ करवाया था, उस सिटी में करवाया था तो मेरा घुटना खराब हो गया. दैट विल रिड्यूस, विच इज़ एक्चुअली द नीड ऑफ द आवर. मतलब घुटने हम जिस स्पीड पे कर रहे हैं इंडिया में, जितने नंबर्स हम कर रहे हैं, वी रियली नीड टू इम्प्रूव द आउटकम्स ऑफ आवर नी रिप्लेसमेंट्स एंड रोबोटिक्स हेल्प्स अस इन दैट. रोबोट इज़ नॉट द ओनली आंसर बिकॉज आपको सर्जरी करने आना बहुत ज़्यादा ज़रूरी है. But a robot definitely improves outcomes. So that is what I'm seeing in my practice over the past 3 to 4 years. That robotics has definitely improved my outcomes because I was also trained without a robot. But when I am been working with a robot, it has definitely changed outcomes.
So one follow-up question. I was told, and I've learned this during my experience with Fortis, that any implant, if you put, has to go through a redo in 12 to 15 years. So whether the implant is put by hand or by robotic has the same meaning?
Actually, it does not, and that is a very good question because first of all, we don't have very long-term outcomes of robotic knee replacement. मतलब 25 साल बाद क्या होता है, 30 साल क्या बाद क्या होता है, हमें इतने अच्छे से नहीं पता है अभी. Saying that, still long-term outcomes should be better क्योंकि आप और प्रिसाइज चीज़ कर रहे हो, आप गाड़ी की अलाइनमेंट और अच्छे से ठीक कर रहे हो या कंप्यूटर से नाप के ठीक कर रहे हो, तो लॉन्ग टर्म आउटकम्स शुड बी बेटर दैन कन्वेंशनल नीज. That is the real moat of robotics.
All right, moving to Dr. Sarath, and it's my privilege to share the stage with him for the second time. Sir, a very simple question. As we look to the future of surgical care, how will next generation preoperative imaging redefine surgical planning and precision, sir?
So that is a very relevant question. So if you look at type of robots that are used, especially in neurosurgery and other areas, you have first a master-slave kind of a robot, which means that you're controlling robot from a remote area. So fundamentally, it's nothing but extension of your arms. And then you have a stereotactic kind of a robot, whereby the robot goes to a precisely predefined location and stays there. So it more or less defines you where exactly is the location of the target. Now the second type of robot is what is most commonly used in neurosurgery, and we've been using this for close to a decade. So the advantage of this is that this will take you right to the target where you need to access that part of brain. Now you have to understand that since brain is obviously a very complex structure, but you have areas which are on the surface, you have areas which are much more deeply located, you have areas which could be very small, and hence target localization is of immense importance. Now in order to localize this target, we need some kind of very precise and advanced neuroimaging. The reason robotic surgery is developing very fast, especially in the area of neurosurgery, is because the imaging is getting redefined again and again. So earlier we would see just a structural imaging using MRI, but now we can even detect functional areas. So for instance, we can do an fMRI and we can find areas in the brain which control speech, or from where our hands and legs movements are perceived, or where we are able to sustain our sensations for the whole body. So you know, brain is the headquarters for everything. So whatever we are is because of this brain. Paradoxically, brain itself is painless, which means if you touch the brain, you won't feel any sensation, even though it sustains all kinds of sensations from the rest of the body. So defining precise imaging is becoming more and more important. So for instance, using the robot, we have developed a technique called as ROCH, which is well established. If you look into the Google, you'll find it, which is called as a robotic thermocognitive hemispherotomy. This is a made in India technique which we developed it at AIMS, and now it's spreading globally. So recently there was a full team from Israel, now they have implemented it in Israel, and there's a lot of interest coming globally. Why? Because it converts a completely open surgery whereby you have to make a large incision into just number of holes through which you are introducing electrodes and burning that area rather than producing a large opening. And it has completely redefined the way we think about this surgery. So that's the way, and it is more so important because this kind of surgery is done usually in kids who are 4 years, 5 years, where loss of blood is very important, maintaining the temperature is very important, and that is why it is making a lot of. So these are the kind of technologies we will expect in the next decade to happen. Now the third type of robot, what I can say is an AI driven robot, which means it's a fully automated robot. It's going to do surgery on its own. Now this kind of robot, I think we are still quite some distance away, even though AI is developing, but it will be quite some time before we can ask the robot to do the complete surgery itself. So when we mean robot, it means that surgeon is very much involved and he is taking help of something by which he can enhance his or her precision and accuracy.
It's a very layman question, and for the audience to also understand, robot is managed by a doctor. It is the doctors who run the robot. And during the course of surgery, in case you find that robot, while robot can do much better job, and we have talked about it, you can switch from doing robotic surgery to a traditional surgery in the course of surgery?
So normally when we do robotic surgeries, we are doing it from very small openings, and these are the areas where our hands cannot usually reach. But it's fully under our control. Like I've told you, it's a master-slave kind of a thing. So whatever movements we execute are the movements what are executed. And in brain, like I've told you, it is a stereotactic robot, which means it will precisely take you to that location and stop. After that, the surgery has to be done you because it shows that this is the location where the target is localized or where you have to perform the surgery.
All right, thank you. So, moving from Dr. Sarath to Karan. Karan, you have been instrumental in convincing doctors and the management to use the robotic device. Standing today, where do you see the acceptance of the robotic device is higher, whether it is higher in a metro city or in a tier 3 city?
So first of all, thanks a lot, and I'm feeling proud that I'm sharing a stage with such a big doctors and dignitaries. So if you ask me about the robotic surgery, I think most of the people know or don't know. The first robot in India installed in 2002 in Fortis Hospital, and the surgery happened in the presence of Dr. Abul Kalam Azad. And after that, there are like different type of robots are there. Surgical robots, which are like soft tissue surgeries, general surgery, gynec surgery, orthopedic surgery, and neuro, even dental, they are coming into the market. But as a big country where 1.4 billion population, more than 70,000 medical facility presence we have in India, how many robots we have currently in India? It's close to around 1,000. Only 1,000 in last 24 years. So the load for the robotic surgery is very high in tier 1 city, and the patient generally travel like 100 of kilometers from tier 2 city. I believe the real potential still lies in the tier 2 cities, and there are a lot of robots are going in tier 2 cities, because we generally think from two perspectives. Like I met with a lot of surgeons and asked them, what do you think the main concern of the patient? And you would be amazed to know, patient has only two concerns about robotic surgery. Number one, who will do my surgery, surgeon or a robot? And the second, is it only for the rich patient? And as a Indian population, we are growing really well in terms of insurance, and they are also started paying the insurance. And lot of schemes, government schemes are also promoting robotic surgery, like Rajasthan scheme, even CGHS also have. So I believe tier 2 cities have a very big potential, but currently in tier 1 cities, the surgeons are much experienced, they are much fine in their surgeries, because the end of the day, why we use robotic? Just to increase precision. And
देखिए इंडिया डेली 24/7 अब आपके स्मार्ट टीवी पर। इंडिया डेली मौजूद है सभी डिजिटल प्लेटफॉर्म पर लाइव और लगातार। इंडिया डेली 24/7 हर दिन राष्ट्र को समर्पित।